Real life.
A very good evening to all the members who are online today. I'm so happy that this is our 23rd series in the Ophthalmic Research and Publication Initiative, or in short, it's very common to us, ORPI. Initially, I'd like to thank the mentor, Dr. Chaitra Jayadev, whose guidance has been there from the beginning till date, and it is because of only her we have been able to sustain this program over years together. I'd like to thank at the same breath to Dr. BNR Subudhi, the Chief Coordinator of this program, and other coordinators, Dr. Sabyasachi Patnaik and Dr. Santosh Mahapatra, for putting up a grand show as it is over months together. I'd like to thank my office bearers, President Dr. Jennifer Basaimot and CSC Dr. Nitin Dhira for helping me to organize this program. I'd like to thank and invite Dr. Vinod Agarwal from ORPI Center, New Delhi, for being the speaker today. We are honored to have our moderator, Dr. Devdulal Chakravarti, to moderate the session today. We have an excellent panel of authorities from EIZOC who will be dominating the scene today. Dr. Dipankar Das, Dr. Vikramjit Paul, Dr. Rakhi Kuchumes, Dr. Deepak Chaudhary, and Dr. Sujata Padhi, and an excellent battery of discussants to take forward the discussion today. With that, may I hand over to Dr. BNR Subudhi for further interactions. Over to you, sir.
Thank you. Thank you, Dr. Devashish. We're welcoming everybody to this platform. So I once again welcome everybody for this, our ORPI program. And as you know, this is our attempt. So last 4 years, we were designed this program, myself, Dr. Sabyasachi Patnaik and Dr. Santosh Mahapatra. But we thought that the youngsters, the postgraduate students who have entered into post-graduation, they should be motivated to write the papers and contribute to the journals. Nowadays, as you know, the journals have increased in number and our work is not at par with the number of journals have increased. So we should motivate our youngsters to come forward. And as you know, the publication is nothing but, there are 5 points, I would say, the 5 things I would say. It's a dissemination of knowledge. Whatever you learn, you will disseminate with others. And of course, validation of your research. Whatever you do, it must be validated. And of course, your whatever number of publications you have, that gives a recognition to you in the national, international level. And also you get, it becomes a foundation for your future works. So that's why we organize this program over the years. And we always get good speakers. And of course, I thank our mentor, Dr. Chaitra, who constantly guiding me to select the speakers and select the topics. I must thank her. And today's, as already Dr. Devashish said, that Dr. Vinod Agarwal, the professor of ORPI Center, New Delhi, is the speaker today. And we start again, because some of the topics have been repeated, but however, we always get new postgraduate students. So this is nothing new for them. So they learn a lot from this, even also repeated discussions makes them more comfortable and more learning. So today's topic is how should you start your journey with publications. These are EIZOC team, the president, Dr. Jennifer Madam, secretary, Dr. Devashish Das, and Chairman Scientific Committee, Dr. Nitin Dhira. They form a good team and really encouraging team. They encourage us to continue this program over the years. Mentor, I already mentioned, Dr. Chaitra is always with us. Whenever we do this program, she is with us. And she always guides in this program. These are my coordinators. And today's speaker, Dr. Vinod Agarwal, I think he will be introduced by our moderator today. Moderator is today Dr. Devdulal Chakravarti. He is a senior consultant with the Desai Hospitals. Currently the in charge of BR services to Desai. And our panelists, Dr. Dipankar Das, who is a senior consultant, HOD, Sri Shankardevan Nethralaya, Guwahati, Assam. and Dr. Bikramjit Paul, retinal and intraocular oncology services at his center called Paul's Retina Care at Ranchi, Jharkhand. Dr. Rakhi Kusmes is the professor, RIO IGMS partner, Bihar, and Dr. Deepak Chaudhary is the assistant professor at RIO SC Medical College, Cuttack, and Dr. Sujata Padi, the professor at MKS Medical College Hospital, Berhampur. So these are our panelists, and these discussants really the postgraduate students. They are Dr. Rasmi Naik from SC Medical College and Hospital, Cuttack, Dr. Mahesh Sahu from Himsar, Burla, Dr. Saki Notial from the Ruby Eye Hospital, Dr. Manas Rajendran, the Agrawal Eye Hospital, Cuttack, Dr. Pinky Sister Panik from MKC Medical College, Berhampur, Dr. Bidusi, Sankadevan Atralaya, Guwahati, and Dr. Neha Gupta from RIO Patna. So these are the postgraduate students who will be discussing the today's topic with the speakers and the moderators. And I welcome you all to this webinar to have a discussion on this topic of how to start your journey to publications. I also welcome the viewers who are behind the screen to watch this program. Thank you. Once again, I welcome you all to this program. Before I hand over the podium to our moderator, I will ask our president, Dr. Jennifer Madam, to say a few words. It's over to Dr. Madam, Dr. Jennifer Madam.
Okay, good evening. Thank you, Dr. Subhadi. Good evening, respected faculty and all my dear colleagues. On behalf of EIZOC, I warmly welcome you all to the ORPI webinar series 23 on how should you start your journey with publications. Publications are essential for academic growth, and today's session aims to guide our young ophthalmologists in taking their first confident steps into research writing. I sincerely thank our speaker today, Dr. Vinod Agarwal from RP Center, our organizing team, mentors, moderator, panelists, and discussants, which is the names which has already been mentioned. And I hope their valuable contribution will be of immense help to our young ophthalmologists. I encourage all participants to actively engage and make the most of this session. With this, I hand over again to our Chief Coordinator, Professor B.N.R. Subudi.
Thank you, ma'am. Now I think it's time to start the program. So now I hand over the mic to Dr. Devdulat Chakraborty, is the moderator for this evening, and please continue. You're muted.
Am I audible now?
Yeah.
Yeah.
Yes, please.
So, very good evening to all of you, and thank you for making me part of this August gathering. And it is really a pleasure to actually introduce Dr. Vinod Agarwal, who actually needs no introduction. In fact, he is currently the Professor Vitreoretinal Services at Dr. Rajendra Prasad Center for Ophthalmic Sciences, and in New Delhi, of course. And he is, somebody who is at the forefront of, providing vitreoretinal care in the country. And he is, he is there currently. He was a senior resident at the Guru Nanak Eye Center previously, and also received fellowship in medical retina from the Wrexham Mailer Hospital, Wales, UK. He was previously assistant professor at UCMS, and he has done an ICO fellowship from Gunma University in Japan. And he was initially appointed assistant professor in the retina services in 2014, and has many academic achievements, 220 or more, in fact, PubMed index publications, 3 named novel signs, the omega sign, the Holdor sign, and the Arcus retinalis. So these are things that a lot of our young friends will be aware of. And I'm if these are not good enough, he's also the author of the Handbook of Clinical Trials in Ophthalmology. He has 8 book chapters, over, like I mentioned, over 220 publications, 50 international presentations. He has a book, 5 book chapters additionally, and 100 or more faculty lectures. And he is currently the PI in 5 multicentric trials. So he has, many international publications. He is the assistant editor of the Indian Journal of Ophthalmology, or rather was the assistant editor from 2018 to 23. And that was a, period where IGO definitely, did a lot of good work. He has the VK Kalra Memorial Trophy Award for the quiz at the annual DOS in 2006. He is a
I think, sir,
distinguished
we can
resource
skip this and
teacher.
come straight to the topic.
Uh,
Yeah, so
oh, okay.
we are just passing on
Yeah.
the time. So
Okay.
we'll
Okay.
spend the time on actual discussion, if you don't mind. Yeah.
Yeah.
Uh,
Thank you, Dr. Agarwal. He's also the JM Power. He has also received the JM Power Award for the best paper at VRSI 2022. So with this, I stop sharing and welcome Dr. Agarwal.
uh,
Just
can I
wanted to
share my?
say, yeah, Vinod, bhai, as you share, just wanted to add a quick word. I've had the privilege of working with Vinod on a couple of papers, and it's really fantastic. I'm sure the kind of insights that he's going to give the youngsters is going to kickstart their publication journey, and it's just very initial beginning steps that you all will learn. It's a long journey, and just take along all these points that will definitely help you reach milestones of 100 and 200 publications that Vinod has. Over to you, Vinod, and thank you for doing this.
Thank you, Dr. Subudhi, for having me here. I hope I am audible and my screen is visible.
Yes,
Yeah,
yes.
yes, yes, yes.
And thank you so much, Dr. Debulal, for kind words, and Dr. Chatra also for introducing me to Dr. Subudhi to so that I can interact with you all. Now, when Dr. Subudhi asked me, since this particular work is or a webinar is aimed at about publication, so I thought I'll tell about my journey, how I started, and I'll be sharing some of my, early days, how it started, what all you can do as, postgraduates or fellows to start your publication journey, and how to proceed. Now, you can stop me anywhere if you want, and I'll be happy to answer any of the questions if you have. Now, typically, if you see, once you step into the field of ophthalmology, you will realize that, or academics for that matter, you will realize that earlier it was told to us that you should publish or you would perish, because especially in highly competitive academia, what happens is if you do not publish, you do not get grants, people do not recognize, and ultimately you perish. But there was always kind of negative connotation to the very work of publications, and then people wanted to change it to little more positive outlook. And then there was a concept that if you publish you will flourish, you know and again, of course, it is positive, but then again you are doing from some motive. What I believe is that you should not publish for any reason. We should publish with passion. The very fact that you want to publish, that's the reason why you should publish, and there shouldn't be any other reason. I always tell my fellows, it's like when we go at say any particular site for tourism, there are thousands of photographs on the internet, but we still take ours and then we publish it. So the same thing happens with publication. Whenever you see something, it's not only your duty to do it, but also you owe it to your patients, as well as your it helps you in leaving the legacy behind. So that is in very short why you should publish. And if you start publishing with passion, I'm sure you would realize it's a fun game. It makes you flourish, and simultaneously you rise to the very top very quickly. Now, what can be published? Now, if you see, this is the typical hierarchy we see in the type of various, articles we can publish. At the very top comes systematic review, while at the very bottom we start with something called case reports or brief reports, small case series. And as we go higher up the ladder, we have cohort series, RCTs, you know, and then critically appraised topics where we actually build some evidence. Now what happens is, very often what happens is we try to start with randomized control trials or big studies which are longitudinal. So once you start doing that, it is not easy to do that. It takes a lot of time. You need to have a very good mentor. So the best thing to do as a postgraduate or fellow is you start with something which is at the very bottom of this hierarchy, and that is case reports or brief reports, or a small case series, you can say. Now once you start doing that, one, they get published easily, so you do not get demotivated easily, number one. Number two, they are easier to write. So once you start writing them, you will find that it makes you addicted to the concept of publishing, and then you can start your journey along the apex of this triangle, so that you can publish more and more at the higher quality of evidence to contribute to the very literature we have read. Okay, so as I mentioned, it's best to start with brief reports. And why you should do that? You know, all of you know that it is one of the oldest forms of medical reporting. For example, a Zika virus outbreak was announced by a case report. For example, when it was Kaposi sarcoma was discovered in young homosexual males, in various parts of the world. Then it led to the diagnosis of AIDS. So it all started with a case report. Somehow, infant was given a propranolol for capillary hemangioma, which regressed, and later it was a case report, and subsequently it became the established treatment for capillary hemangiomas. Especially for pharmacovigilance point of view, it's very important, because it tells us what new side effects a particular drug is having, and again it forms a very important part of pharmacovigilance. So for example, thalidomide tragedy was link was suspected by a case report. uh, One set of authors reported that a Ozurdex implant moved into the anterior chamber in an aphakic patient, and subsequently we recognized aphakia as a contraindication for Ozurdex implant. So don't think that a case report is useless. Case report can be very useful, and it can help you form important guidelines of the future. And most importantly, from postgraduate and fellows point of view, the case reports serve as a platform for training in scientific writing and critical thinking. As I mentioned to you earlier, they are very important to make us learn how should we go about the very fundamental of publishing. When you start publishing, you will realize there are various guidelines by various journals. They all are different. You need to prepare your manuscripts according to them. Initially it may seem very difficult, but slowly and steadily, once you start writing, you'll find that they are by and large the same. And when you start writing the higher forms of evidence in the form of original articles and RCTs, you will be well versed with the art of scientific writing and various journals which are available. Now, uh, so it is at the lowest level of evidence, but they are the first line of evidence, and that is how one can start as postgraduate. So usually these are the parts. I think I'll not go into the details and bore you with that, but this is how various parts are written. But I'll tell you some of my initial publications, how it started and how it went on. So what do actually we do in a case report? So anything, we know that science, nature of the medical science is such that it is very, very variable. No two cases behave the same way. No two cases present with similar kind of findings. So if you are well versed with your subject, so moment you see something which is unusual, moment you see something which is following a pattern which is unusual, or the follow-up is unusual, it is kind of case report, and you may be able to report that. So I'll again skip this part. I'll give you some of the key things you need to have before you write a case reports. The most important thing for doing any brief or case report is that you document at the baseline. Okay, so once you do the documentation, I'll give you few examples how it helps. Then second thing is that patient should be traceable. So you have done that documentation at baseline, and subsequently once the patient is in follow up, you will realize that many of the patients won't follow a pattern what is described in book, and whatever takes a D route is a candidate for a case report or a brief report. And if you're not sure about that particular entity, you can always do a literature search, and that will tell you what has been reported and what has not been reported. So I'll give you a few examples. So some of these are, this is in fact one of my first case reports in IGO way back in say 2008. So I was a senior resident then, and I had gone to medicine ward, to see this particular referral. And this was basically a case of dengue fever, and the patient had bilateral ecchymosis. And when I went to the ward, at that time, my most prized possession was this particular phone, which could take the color photo. So all I did was took a photograph with this particular phone. And later on, when I came back, I realized that this particular complication has never been reported with dengue fever. We went on to report it, and that is how my journey of publication started. So all you need to do is take a picture of, I always tell my fellow, whenever we go to a place, anything we find nice, we always take a photograph. And in fact, in today's scenario, it is very, very easy. We have high quality cameras always with us. You can always take a photograph, and all you lose is some space on your hard disk. So while that was a very basic form of technology to document, again, see, this is a patient who presented to us with post trauma, and you can see there is some bucket handle like appearance here. Now this is very typical vitreous base avulsion. We have all read about it, but if you go and search literature, there is not even a single photo. The reason, because you cannot document such anterior periphery of the retina. So once we had the Optos camera with us, all we did was took a picture of this and sent for publication. So it's a very simple thing. All you need to do is take a picture. So what I wanted to tell you is that you can use a very simple camera or a high-tech gadget like Optos camera, depending on the situation you have. And as is said in photography, it has no rules. It's not a sport. It is the result which counts. And in today's scenario of digital, photography, all you need to do is keep clicking. And whenever you get a good photograph, it's worth publication. So have a look at this particular photo. Not a very common condition, but beautiful pictures. I'm sorry, most of my photographs would be from retina because I'm a retina specialist. So you'll have to bear with that. So you see these are multiple white flecks over the retina. All we did was took a photograph with Optos camera and some autofluorescence pictures, and we could publish it in JAMA Ophthalmology just as images. So you'll find that many of the journals now allow images to be published as brief reports, and these are indexed. In fact, all high-end journals also have started taking ophthalmic images. So anything and everything which you find is very beautiful is publishable. As I said, documentation is the backbone of publications. Never hesitate in documentation. All you lose is some space on the hard disk. So again, a little story. So I was doing this vitrectomy, and as you all know, when we finish our surgery, what we do is we indent the periphery of the retina and check for any breaks. So the same thing I was doing in this particular diabetic. You can see some laser scars. So when we were indenting, what we saw was there some cystic spaces on the pars plana. Now these are something known as pars plana cyst, and again, since they are very interior, it's very difficult to see them. They have not been documented photographically. So all I did, in rather one of my fellows did, is we recorded the video and then took a still from the video and sent it for publication. So they were published as brief report. So again, just telling you that it's important to document. So always document. So these are two scenarios. You know that if you take your picture smartly, then which photograph is likely to be published. So always take your picture timely and smartly. So again, short story. This is a patient who came to once in my OPD, and this was the scenario on the cornea. Now, if you see, there are some deposits on the cornea, and one will typically think of nodular keratopathy. Now, when I saw this patient, I don't know what struck me, but I took out my camera and a picture of this photograph, this eye. And later on, when we worked up this patient, we realized that this was nothing but a bandage contact lens which had been put in an eye with bullous keratopathy. But the patient never came back for removal of the bandage contact lens. And this was nothing but deposits on the bandage contact lens. So now, if I had not taken the photograph which was on your left side, this would have never been published. So that is the importance of taking photograph at the baseline. Take a photograph and it will help you in publication, because you never know what it is going to be turning around. So at times, document case may not be a rare one. Look what is different in a given case, and when you start sending, you realize that it may not be accepted by one journal. But do not let rejections demotivate. Always, modify your manuscript. Take the help of your seniors. Review the comments which have been sent by reviewers. Improve your manuscript, and then you can send it to next journal. Novelty is something which is must for publication, and inherent vast nature of the medicine makes your work relatively easy. Since no two cases behave similarly in long run, so if you keep persevering your cases, you will find that you have many cases which are worth publishing. Again, a very small story. This is a patient when I was senior resident. He came with such a fungating mass in his left eye. Uh, and when we looked closely, you see that there were some insects which were there in the orbit. And in fact, I'll show you a little video. We made a video through the microscope, and you could see these insects were moving. And then this was a very foul smelling fungating mass, and we realized that these were nothing but maggots. We read about how to take out these maggots. We got castor oil, put in the orbit, and then took out these few of these maggots. So around 50 of them we took out from the orbit. And since there was a fungating mass, we found that this fungating mass was harboring a basal cell carcinoma. So we exenterated the patient, and subsequently he was sent to ENT, where a patch graft was done from the forehead. So this was whole journey which went through 2.5 years, and we reported it, again highlighting the fact that since it is a case report, it's not necessary that you have not put effort. At times, a lot of effort and lot of time will go into writing even a single case report. Again, an very unusual disease and very unusual outcome. So this, if some of you, if you can recognize, it is something known as Irwan syndrome, where you have arterial aneurysms, especially at the bifurcations of the vessels. Now, typically, these patients they respond to steroids, and when in this particular patient we gave steroids, the aneurysms just vanished. Now that is a very very rare thing to happen. So all we did was presented our photographs pre-treatment and post-treatment, and we could publish it. Second important thing is that we all have some complications, and as a matter of rule, people do not like to present your complications. So on the contrary, complications which you report are much easily accepted, because they form a very important part of literature. So this is way back, when we just started bevacizumab, injecting bevacizumab, we found that in a patient with diabetic macular edema, it actually caused ischemic maculopathy. and we reported it, and this is one of our case reports which is highly cited. And even today we do hesitate to inject anti-VEGFs in eyes with ischemic maculopathy. So that is the value of a case report. You must report your complication if they are unusual. Whatever a deviation happens from your routine cases provides opportunity for publication. But then again, good knowledge is necessary, because you would need to know that something unusual has happened. That is how you will recognize the case and report it. So something which appears common can have scarce publications, and something which are uncommon can have several papers. So these are few such examples, of my publications. For example, X-linked retinoschisis. We all know that typically the peripheral schisis happens in the infratemporal area. But in this particular case, we had a child which had nasal involvement. So we were able to report that. Similarly, again, a case with neurofibromatosis type 1. We all commonly see it. We just see rich nodules, uh, you know, and then we are happy. But in this particular case, we were able to see choroidal hamartomas, which are reported but which are not commonly seen. So all we realize that infrared imaging is the one which is able to pick choroidal hamartomas. So we reported that, and nowadays I think these choroidal hamartomas are one of the biomarkers of neurofibromatosis type 1. Do not give up. Now again, a little story about this particular patient. So if you see, this is a normal looking fundus, but if you see carefully, this is this large vessel, and which is going right through the fovea. Now when I first saw this, when I realized maybe something is abnormal in this, and then it took me a while to recognize that a normal vessel was going through the fovea. I did not have the answer what is this condition called. I kept asking several people. But one fine day after 2 years, one of my friends told me maybe this condition is called a congenital retinal macrovessel. So when I searched, of course, it was a congenital retinal macrovessel, and we reported it. Now you will realize, till few years back, there were only 40 publications on this particular subject in PubMed, and out of these 43, 5 have been reported by us, meaning thereby just that this is a condition which is commonly seen, but people just do not recognize it. Okay, so that is the message I wanted to give you, that if you see something, you will start seeing it. So it's very important that you have a good knowledge of the subject. Once you start seeing the findings, you will be able to find several of them. You can always think out of the box. For example, again, a very common condition, myelinated nerve fiber. Now we all see it. So all I did in this particular thing was collected all the patients and made a montage of them from decreasing order on your top left to the increasing order in your bottom right. So it's an increasing order, and once we send it for publication, we could actually be covered on the cover page of the journal. So again, it's a very small thing, but all you need to do is think out of the box. At times you have to be to be brave. For example, you see a macular hole here. It was sitting atop a choroidal hemangioma. Now it had been denied surgery by several surgeons. We talked to the patient. He was ready for the surgery. We operated, the hole closed, and subsequently we reported it as a case report. At times you take different treatment method. Typical a macular hole with subretinal bleed, you would manage typically into two-stage procedure, but we managed it in a single stage, and we could report the outcome. At times you are simply lucky. For example, have a look at this particular photograph. This looks like a gyrate atrophy, but it isn't. Again, when I saw this, I thought there was something abnormal. I kept searching this particular diagnosis, and it took me again at least 2 years to find the diagnosis. And once we found the diagnosis, which is mentioned here, it had never been photographed earlier. And the beauty is that it had never been reported from India. We try to trace it back to the country which it has been reported from, but somehow we couldn't. But anyway, because it was a very nice picture, we could, publish in a high impact journal. Or you see this particular fundus again looks like normal something, but if you carefully see, all the vessels appear yellow. So this is something known as lipemia retinalis. So again we worked up this child with lipemia retinalis, and there was an unusual publication, unusual association of lipemia retinalis, that is primary chylomicronemia syndrome, and we could report it in the Lancet. Okay, so again I'm trying to say is, when you start knowing your subject and working up your cases, you will realize the in medicine will give you lots and lots of opportunities, and you just need to grab them if you're well read. So luck favors the well-read. At times you can come across things which happen not so unusually. This is a combined hematoma. You know that there is a epiretinal component in combined hematoma. In this particular patient, it separated spontaneously. Again, something which had never been reported, and we could report it. So to summarize, case reports are the beginning of a new discovery. I believe all of us, literally all of us, see at least one case report every day. The thing is that we do not see it from that perspective. Once you know your subject well, you will find that every case is taking a different path. And the beauty is that in academics, you can report everything that is weird and wonderful. The only thing you need to do is a good documentation and think out of the box. And you will be surprised to see that now many of the journals, for example, American Journal of Ophthalmology, Indian Journal of Ophthalmology, Retina has a special journal on case reports. All these journals have started a separate journal for case reports. And also, as I said, many high-end journals, for example, ophthalmology, for example, JAMA Ophthalmology, even NEGM, which is the one of the highest impact factor journal in medicine, Lancet, all these journals carry a section of ophthalmic images, and once you know what is beautiful, you can report it. Thank you very much. I'll be happy to take questions if any.
Wonderful presentation, Dr. Vinod. And like you mentioned, you have to start basically at the bottom of the pyramid, so to say, and then it becomes easy. So, any questions? I don't see any questions in the chat boxes. We have residents here, so any questions to take things forward? Okay, once they, yeah,
Wonderful
please.
presentation, Dr. Vinod.
Thank
That's
you.
very good way, starting with a case report. Yeah, the residents can take up case reports, the images, the photo essays. That's a beautiful way, the brief presentation. Then and the review and other bigger article can be in the later part of the night. Wonderful presentation.
Thank you, sir.
I would like to, ask Dr. Dipankar Das, who is also, who has many publications. So, what is your take on, how to get started? You have a lot of residents at Shankar Deva Netralaya. So, what is your suggestion to them, and how you ask them to, sort of like Dr. Vinod mentioned, what is your USP? So many reports. What's your field of interest, maybe?
Yeah, from resident point of view, see, there are 3 years for DNB. I'm not talking about the diploma DNB courses. The 3 years of DNB, the first year they are very new into the thesis and other thing. Second year is the mostly they can use for their all this research innovative way. And their final year again they are busy for the examination point of view. So I always stress that in 3-year MS degree and 3 years DNB, second year, all the students should explore much more for the research work. To start, as Dr. Binod showed, if you get a unusual case with a extraordinary finding, unusual finding in a image, then you can have a image publication. IGO case report has a image publication. That's wonderful. Second thing, as Binod said, there may be AGO and other journal which take up images. And some reports you cannot put for case reports for 800 or 900 words. You can make a 300 words and make a photo essay. If you have good photograph, you can have a photo essay, and this also give a lot of importance in your then what is important thing is that when you get a case to document it very nicely, you can have a team of what you call residents who can work together, and you spend some time in writing the report. Says sometime in the second year, you make a time to make this habit of writing the reports. And as Vinod says, you search for the literature, what are the existing literature on the topic, then you can, and if you find an extraordinary finding in your case, you can put it a case report. So always start with small, but this will give a lot of things. What Dr. Binod said is that thalidomide study which change entire phocomelia and other things was a single case report. Okay, such a wonderful report, and that came to the greater extent of the thing. So start with a smaller thing, and gradually you can. And another important thing, after your final examination, make sure that you publish your thesis, okay, in a peer-reviewed journal. That is very important message for your entire care.
Thank you, Dr. Dipankar Das. Subudhi sir, would you like to, mention anything at this stage?
What I suggest, why don't you ask some questions to the postgraduate students? Because there are some 5 to 6 postgraduate students are there, and with this wonderful lecture, whether they have grasped anything, whether they got stimulated to write the next case report to them. So I want to ask them, please put a word to these people. There are 6 postgraduate students are there.
Good
Yeah.
evening, sir.
Yeah.
Sir, I had a question, if you
Please.
may allow.
Yes, please.
Sir, how do we choose, like, when we get a case report in our hand, we've documented, now we want to write. We write a framework, and now when we want to submit it, how do we choose which journal do we pick? Suppose the case belongs to a glaucoma, should we directly go to a glaucoma journal, or do we start with which journal to choose is usually a big question for us sometimes.
Dr. Vinod, please.
Yeah, I think that's a very nice question. So I think once you start as a postgraduate, it will be very difficult for you to decide where to send it. So typically, for example, for my fellows, I would tell them, if you are writing this, this will go to this particular journal. That is something which you get with experience. But overall, on a general basis, if it is something which is very highly specialized, for example, I gave you an example of Irvan, where the macronisms disappeared. Now that is something which will not be of interest to a general ophthalmologist, so that will be suited for a retina journal, while something, for example, dengue ecchymosis, that will be suited towards a general ophthalmology journal. Okay, so whatever is of interest to a general ophthalmologist would go to a ophthalmology journal, while something which is very specified, very very limited interest, that will go to specified journal by and large. But again, I think this is hack which you get with time once you start sending few journals, few articles, and your mentor or your guide should be able to help you with that.
Thank you, sir.
One question that I've often been asked by many of our fellows and some of our juniors. There are a lot of journals, of course, in the ophthalmology scenario, but most of them or many of them they charge a lot. Besides, of course, our own Indian Journal of Ophthalmology. So, what would be your maybe 4 to 5 recommendations for journals who do not charge a lot, who charge at a minimum level maybe, or are free for especially for our residents and fellows?
I think IGO does not charge very heftily. It is minimal, and we do get some advantage in IGO, and uh, in my experience, I think I've never had a problem with respect to charges. If your manuscript is good, you send it to a journal, they find it good, it's worth publishing, you can always tell them that I'm a student, and they will never ask for charges. That is number one. Number two, I think many journals just charge for color figures. So if you tell them that you can publish online color and print black and white, that again would help you in taking off the charges. And third, and I think again, many of our institutes do help us in getting kind of, help or some reimbursement for the publication charges. And I think most institutes have some way or the other to, help the students. And last but not the least, you can always skip one holiday and publish. I think that in that one publication will help you get many more holidays.
Yeah, I have few things to say when the monetary thing is there. For example, you should shun away from the predator journals. Okay, that's very important because no, your article should be peer reviewed and it should be the as IGO charge the photo processing money they charge, it does not charge for accepting the manuscript. Accepting the manuscript is charged by the predator journal, where you should not submit your most. Sometimes we also give, but so for a newer generation of resident, they should always try to publish in a peer-reviewed journal. That gives a lot of importance.
Yeah, I think
And
that's a very, very important point. Yeah, please carry on.
And secondly, one important thing is that at Vidushi asked, first of all, once you choose the journal, read the instruction to the authors very meticulously, line by line. Then you draw the what are the lines to be given, what are the things, and you then send according to the instruction of author should be very nicely read by the residents before submitting.
Absolutely. I think, it's very important to actually find out whether what you are publishing goes through a peer review or not. And you will, receive many emails from various journals, submit within this date or that date. And, this is for, say, now it is January, this is for the February issue. Remember, my young friends should remember that, these are journals which are, initially might not ask for some charges, but these are basically predator journals who are going to rob you in some way or the other subsequently. So be very careful of somebody being over friendly as far as the journals are concerned.
So
Yeah, please.
one way of checking is that you check whether it is indexed with PubMed or not. I think that is something which is very important. But nowadays there are many open access journals. So they are not predatory, but they are open access journals. So they are indexed with PubMed. But again, they charge a lot of money. So when you are beginning to submit your article, as Dr. Das said, it is very important that you look for the article publication charges section. Okay. And usually, in fact, many of the journals, even the top end journals, now allow you to publish open access. Okay, for example, JAMA Ophthalmology, or a journal like even Indian Investigative Ophthalmology and Visual Sciences. So what these journals do is, either your article can be published on subscription basis. That means you will not pay any money to publish, but the any person who wants to read it will have to pay some money to the journal unless he has access. The second way of publishing is you publish open access. So in that scenario, you will have to pay money so that that your article is of open access to everyone. Now it helps you in increasing the reach of your article, but then you have to pay. So these are minor things which I think do come when you start publishing a lot, and you will learn them very quickly.
I'd like to request our other panelists, Dr. Rakhi, would you have any comments or suggestions? You are muted. You are muted.
Yeah, first of all, I congratulate Dr. Agarwal for such a comprehensive talk, and especially highlighted the role of timely and smart documentation. That is, I think, very important, and every resident should understand in a very early stage if they want to publish. So every day in our OPDs, we see a lot of patients, but there are few patients, like one or two patients, they have unusual findings, not very rare findings, but definitely slightly different from others. And these are the patients where we should be more attentive toward those patients. And as Dr. Agrawal said, we should take the photographs, we should document it properly, we should take a timeline of history, everything, so that if the patient turns into something interesting in as per the outcome, or some rare disease, or some unusual disease, or associated with some systemic findings, that would definitely help us to publish those articles. So in residents, I have found that nowadays residents are more, patience-less, that they submit the article and they want that it should be accepted in one or two go. They don't have patience to revise it again and again and to choose the better and better journal. So first they should opt for the index journal, as everybody said. And if the article is not of that grade or not of that interest, then they should go for non-index, but of course not for the predatory journal, because these predatory journals have no space in the literature board. So they have to these things in their mind while starting their publication journey. And definitely it requires a lot of effort, persistence, and there is no space of any,
Shortcuts.
fast things. You have to be patient for this.
I would like to ask our Secretary EIZOC, Dr. Debashish Das. Sir, are you there, Debashish Das? I think he's lost the connection somehow, or network. So, Dr. Deepak, yes, Debashish Das is there. Yeah.
Hold on.
So, yeah. So, what I wanted to actually know from you is that, a lot of us are working in sort of institutes, or, maybe in the government setup. But when it comes to private practice, how to actually, still carry on the baton of publications. You of course work in institutes also, but you have a private practice also. So how do you balance looking into your patients and finding a way out? So what would be your suggestion to a lot of our youngsters who will be going into private practice?
The answer is there in Dr. Agarwal's talk today: document, document, and document. And once you document, I think wherever you are, either in the private or in the institution or even in a government setup, if you have a documentation, you are through. From your case reports to your study reports. That is the only buzzword I feel. That's what we had been doing. I was there as postgraduate in Shankar Netral, and that what we were whipped upon us: document your cases, do what you document, document what you do. So that was the buzzword. And what Dr. Agarwal said, the same words we have to hear: either publish or perish. So it's there's no midway. So basically, what remains is, if I'm able to document a good fundus picture or an anterior segment picture, And if there is a series over 10, like Dr. Agarwal showed, that optic nerve, medullated nerve fibers. So I think these itself will compile and prepare data for you for publication in whatever format, in whatever journal. That's my take.
Yeah, I think that's very important. Documentation is something that's of paramount importance, and one
Yes.
has to be, careful about what we actually write on the, case sheets also, because, we tend to see a lot of things and we miss out finally when we're actually writing something or beginning to write something. Maybe it's a retrospective study, and if it is not fully loaded, then, you have a problem of finding out what, you are actually thinking. So a lot of cases go into exclusion. So I think that's very important. Document, both from the photographical point of view as well as from the clinical point of view, and you have to jot down things. So, Dr. Deepak, your comments, your take on, today's, subject.
Thank you, sir, for giving me the opportunity. It is a very nice and informative talk by Dr. Binod. Actually, sir, for promotion in medical colleges, NMC is recognizing case series and RCTs and meta-analysis only. So case reports, photo essay, and other, they have no importance in promotion. So most of the faculties in our medical colleges are interested in doing case series and RCTs. So I urge our faculties also to write the case reports and guide our postgraduate students to begin their journey in publication. That's all, sir. Thank you.
I think that's a very important point that you've made. It is all right for the faculties for promotional purposes for going into larger series and original studies, etc. But then it is also our duty to guide our youngsters to actually write case reports, or maybe a photo essay or an ophthalmic image for that matter. And I think that is the way forward. Dr. Vinod, please.
I think I fully agree. I've come across few faculties in medical colleges, like they become faculty, but they don't know how to write original articles. Now that is a problem. The question is that you cannot directly learn to write an original article. That is something which is very important. So if you are thinking of academia, it's very important that you start now, learn the very heck of it, how to do it, because it takes a lot of time. Each publication is a hard work. It takes 4 to 6 months, and for one publication, if it is original article, prospective study, it may take up to 2 to 3 years to complete the study and then compile the data and then publish. It may not get easily published. So it's a lot of work which goes. When we talk about numbers, people say 100, 200, 300. It might just appear a number, but when you actually start doing it, you realize that doing 5, 7, 10 publication is not easy work, especially. So you should start early if you are thinking of academia. And as I said, you should not do it for anything. When I started my journey, we had fun, we started writing each and everything we saw, and slowly we learned, and then we realized it's just way of life. Everything we see, we just kind of publish, collect the data. And uh, you for the postgraduates, you will be surprised, once you write a particular article, it be it a case series or brief report or original article. You have to read so much about that particular about topic, and you will realize nobody knows more than you about that particular topic. So you write 10, 15 different case reports in a particular, or any, not even case reports, any kind of article in any subject. Suddenly you realize that your level of knowledge has jumped up, because you have to go through all the literature. And it is very heartening kind of thing. I remember when I got my first publication, I actually got up, jumped on my bed, that, oh yes, we got one, and that was in American Journal of Ophthalmology. And the same year we had to go to American Academy of Ophthalmology, and being a postgraduate, we didn't have fund, and I just got grant based on that single publication, which was there in American Journal of Ophthalmology. So it is such a wonderful journey. You get to meet so many people, you get to travel, you see so much happening, you read so many articles. It puts you apart from everybody else.
Yeah, that's it. The zing it provides is really awesome once something is published, Dr. Sujata, our panelist, are you there? Uh, would you, Dr. Sujata Padi, would you make any comments or observations?
Yes, sir. Good evening. It's a nice talk, sir. It enlighten our knowledge about the publication. I am also in government setup. For promotion, we need publication, but not only for promotion, but we should encourage our PGs for research, and they should read more article to gain the knowledge, and they should keep the mind open whenever they come across new case or any rare finding. They should document the findings, and so that it will be helpful for their thesis work also. Thank you, sir.
Thank you, ma'am. I also believe Vikram is there. Dr. Vikramjit Pal, are you there?
Can I make a small comment?
Yeah, sure. Please, please.
Yeah. So again, for the postgraduates, I firmly believe many of the clinicians, who are all great surgeons, they do a lot of difference to in the life of a patient, but that surgeon's lifespan is limited. He's ultimately going to go off, and that patient's generation is going to go off too. So your legacy is not there. You saved the eyes and the light of so many people, so everything will go away from this earth, but whatever you put in the literature, that is going to that is going to be there forever, and that is one of the ways to make you immortal in the field of ophthalmology, that you publish.
Absolutely. Would our president, Dr. Jennifer, would you kindly, uh, give us your thoughts on today's presentation? I think we are nearing time. So, uh, Jennifer, ma'am, are you there? I think she might be losing her network. So, Buddhi sir, maybe we can take a comment from you, and it's already past 9, so maybe we can take your comments and then. Are you there, sir? Dr. Subudhi sir?
Yeah, he's there. Sir, I think you're muted.
Yeah,
I want some comments from the postgraduate student, Dr. Neha, Dr. Neha, Dr. Pinky, Dr. Rasmi. Are you there, all of you there? Dr. Manas?
Yes, sir. Good evening, sir. I just want to ask, is in basic writing, scientific writing, is AI allowed, and how, as a PG1, we can use it ethically?
Okay, I think that's a very important question. The thing is, uh, you can use it. There are specific guidelines with respect to various journals, how much content they allow through AI, and you have to give your submission as in how much content has been taken from AI. So that particular stream is coming up. You need to make the submission as to what part has been written by AI. Many journals are allowing nowadays.
one word of caution here is that many of the AI GPT models that we have, they provide us with a lot of wrong literature, fake references, you can search in your name and it'll come up with things that you don't know about yourself. So I think one has to be very,
Yes,
very
sir.
careful, and you have to be the master and not, let GPT or Gemini be the master. So I think that's something very important.
But
Yes, yes.
by any means, AI generated data is not accepted to any journal.
Yes,
Absolutely.
yes. Of
Yeah,
Absolutely.
course,
it's not accepted.
you can't take data from GPT. You can help in framing or maybe writing
Yeah.
the manuscript, but not the data.
You can go for the grammatical correction, sentence reframing
Yeah.
to some extent, but
Yeah.
not exactly the image creation or the data and tables. These are not accepted.
Yeah.
Okay. Thank you, ma'am. Thank you, sir.
So I think now it is time to summarize, and I think you have to leave. So really, it's a wonderful webinar today, and I think last 4 years we have repeated this topic 2-3 times, but today I think it was really wonderful today because Dr. Vinod has not only explained it very thoroughly and also showed us some of the pictures with case presentations, I would say. It's a really wonderful case, and that definitely our students must have been motivated. And there are some postgraduate students, first year also, second year also, third year also. There are students probably they've been enough motivated, and I think they've been guided properly to write case reports. It's a very easy thing, and I also guide my students. They are here. They already left, I think. There are two students, but they are here. I always motivate them to start with writing a case report. And it's very easy, very easy. It's not at all difficult. So whatever you see, put it in a paper, pen and paper, and it becomes your article. So, and nowadays, every state has got its own journal. So to start with, you should start your publication in your own journal. That will be easy. And that will motivate to go to the higher end journals like the Indian Journal of Ophthalmic or other journals. So that definitely it will become easy. So thank you, Dr. Vinod, and really it's wonderful lecture from you, and probably we will be seeing you a lot in the future too, because we will continue for a few years to come.
Thank you, sir.
And on behalf of EIZOC, I really thank you very much for being with us for this program. And
Thank
Dr. Devdulal, our moderator, really, I think, wonderful today. And I came across a lot of things from Dr. Devdulal. So your moderation is really good, and you extracted the salient point from all our panelists and our post-graders too. So thank you, the panelists also. And last but not our one mentor, I think Dr. Chaitra has left because he was busy somewhere, she told me. And really thank Dr. Chaitra to pick up a good speaker today, good topic too. So thank you, EIZOC, Dr. Devasis, Dr. Jennifer, and Dr. Nitin to support me in this. I don't think it's a rare adventure, but it's a really good adventure for the introducing the postgraduate students to different speakers, particularly for the research purpose. And I have also was recently in the last, few years, we have a society called Forum of Ophthalmic Teachers. And this actually 40, this has come up shortly to last week. We had a conference at Bhubaneswar, and a lot of discussion on how to publish and how to do research work and how the 40 can help the teachers in motivating the students to for the research and the clinical and presentations and so many things. So we are coming up with a lot of things for the research. So thank you very much. And I think it's now time for dinner. Good night, everybody. See you after fortnight again, once again in this RP 24. Thank you, Dr. Das.
Good night.
Thank you so much.
Good
Thank
night.
you,
Thank
sir.
Thank you,
you.
sir.
Good night,
Thank you.
everybody.
Good
Good
night.
night.
Thank you, sir.
Thank you, everybody, for being
Thank
online
you.
with us.
Thank you so
Yeah,
much.
good
Thank
night.
you. Good night.
Ma'am, good night, ma'am.
Good night.
Good night.